Yeah, hi everyone. Uh, so I just want to give you a brief idea of what we are going to do in the upcoming 10 days. Okay, so the 10 days of plan of action, how you need to cover the things, how you need to manage the stress levels, and how you need to balance your preparation. Okay, so that is more important. And few people, as I interact with few people in the offline and few people through the calls and messages, they are more worried like how to handle this particular module where many of the tough subjects are here. Okay, so don't feel this as a tough area because uh, this area is mostly a combination of subjects. Okay, so it's a combination of subjects. We are dealing physiology, right? And physiology is just the next level of physiology is just continuation with general medicine. A part of microbiology will be covered here, and next continuation is pharma. So all these they go hand in hand. Okay, so don't consider them as separate subjects or don't worry about them. Okay, so just try to be focused and try to follow the things which are given as a task by the group. And the plan for the next coming 10 days, so 1st October, according to the schedule, we need to cover CNS and ANS, out of which ANS is already done on the group at the best. And apart from this, even after completing of chemotherapy, I have dropped 2 hours per day for chemotherapy for the upcoming days because that is an important area where the paper setters regularly ask questions. So chemotherapy you can do every day. LA, GA, and general pharma you can do every day. Like whenever you feel, you can open back, see the codes, mnemonics that are given, and just try to cover these 4 topics. These topics are common. ANS is already done. Again, there is some time for ANS according to the schedule, and you need to be more focused on CNS. So how to cover CNS? Okay, the first thing that you have to do is you have to cover the physiology. Then you need to go and simultaneously cover the general medicine. Then you need to come and cover the pharmacology of this particular CNS. And most of your questions area of CNS, most of your questions will be from the areas or from the diseases of dental pulse. And trigeminal neurology is the most common area where they love to ask questions. So you need to go very deep into trigeminal neurology, and rest all diseases or syndromes of central nervous system which were just focused on the dental pulse or which were given as an MCQs in the dental pulse, you can just try to cover them. Okay, that's more than sufficient. So coming to the 2nd October, the tasks that are to be done are GIT, liver, and kidney. So all the aspects. First, you need to cover physiology. Then you need to go ahead and try to cover the general medicine point of view, means the diseases of GIT. So most of your questions will move around peptic ulcer. And there are few syndromes again in GIT that you have to make a note and you have to learn the clinical features. Livers is already covered. Most of the hepatitis is the area, and cirrhosis of the liver is an area. So most of things are already covered in various other subjects. Coming to the kidney, mostly physiology based questions will be more in this area rather than the disease. Okay, renal failure and everything are like very lessly focused. And nephrotic syndrome and nephritic syndrome is an area where they love to ask questions. Anyway, we are going to cover on the group. You just try to focus on physiology and just try to cover the general medicine point of view and few diuretics and everything in the pharmacology point of view. That is more than sufficient for examination point of view. So next goes is 3rd October. You'll be focused towards the respiratory system. So respiratory system, first you need to cover physiology. Then you need to cover general medicine. Most of your questions will move around asthma, squamous cell carcinoma of lungs, and I mean there are few other diseases which are important, which will be covered on the group. Don't worry. And then you can go for the pharmacology, the drugs that are used for the respiratory system. Okay, so then comes the most important areas. Okay, so that are to be done on 4th, 5th and 6th. So one most important area is endocrinology. So in physiology point of view, in general medicine point of view, this topic is very, very important, and it is directly or indirectly related to the dentistry. And the next one is blood. The blood is utmost important. You need to cover the physiology of the blood, followed by you need to cover almost all the diseases, anemias that are related to the blood, and followed by you need to cover the basic blood clotting systems and the deficiency of the clotting systems. And you need to know about the antiplatelet drugs, oral antiplatelet drugs, anticoagulant drugs, and ferrous supplements, and everything which are very, very important in blood point of view. So you need to work more on blood. And coming to the last but not the least, that is muscle and nerve structure. Okay, this is more of a physiology topic. Okay, so these are easy. You need to spend some time. They go very fast. The trickiest areas are going to be your CNS, ANS areas, where you cannot understand few classifications and drugs, and whereas rest GIT, liver, kidney, respiratory, endocrinology, blood, muscle and nerves, and these are the very simple areas where you have to be focused. You need to prepare. You need to sit for longer duration of time. Once you sit for longer duration of time, these things, they go very smooth and they go very cool, and they are something like a concept oriented things which can be easily understood and which can be remembered for a longer duration of time. So this is what you need to do in the upcoming few days, and followed by the leftover days, like by 6th according to the schedule we are going to finish, and 7th, 8th, 9th and 10th you can keep it for revision, and 10th is your grand exam. And this grand exam will be focused on all the subjects that are covered up to now. Okay, so you plan revision of these 4 days, whether you want to focus. And of course, most of your questions, more than 90% of your questions will be from 3rd module syllabus. Okay, that I can promise you. So you prepare, like whether you want to go with the 1 and 2 modules and have a revision, or whether you want to focus only on the 3, and then you can plan accordingly with the 4. Okay, so next is we are going to start the 4th module from October 11th. Okay, so you prepare your mind and you just try to manage, but make sure this area is very, very important. Okay, things has to be done from 1st October to 6th October, which are very, very important. I'll be more aggressive in the group also. We'll try to cover as many aspects as possible. Okay, so first is CNS and ANS, and second you need to cover GIT, liver and kidney, and third you need to cover respiratory system, fourth you need to cover endocrinology, fifth you need to cover blood, and sixth you need to cover all the miscellaneous aspects present in your pharmacology and physiology and in your general medicine, including muscles and nerves. Okay, so this is what the plan of action for the upcoming 1 week, and followed by you have 3 or 4 days for revision, and all the best for exam on 10th. Okay, so on 10th, exam on 10th, so I'm thinking of to keep as the AIMS is approaching, so the exam will be in the NEET format, but the few question models will be from AIMS. Okay, so everything is self-explanatory on the site, don't worry about that, and get ready. You need to experience everything, right? So the paper will be a bit tough, and I want you guys to score at your best. All the best. Signing off, MDS Conquer, Srikanth.